This is Inside Mside, your favorite podcast for all things Morningside. Hear stories from students, alumni, faculty, and more about what makes the Morningside experience so special.
And welcome back to another episode of Inside Mside, your podcast for all things Morningside. I'm Alex Waters, your Director of Alumni Engagement. Excited to be here, back again to interview and talk with not only two incredible people here at Morningside, but two alums. It's always exciting when we can get folks that are not only making a difference at this institution in a professional capacity, but also have such a good legacy from their time at Morningside, and now we're just paying it forward for future graduates. I'm joined by Interim President Chad Benson, as well as Dean of the School of Nursing and Health Sciences, Jackie Barber. Both of you, welcome. Welcome back to the pod. I've had both of you on, but it's excited to get you back together.
Thank you.
Thanks. Excited to be here today.
We're talking about St. Luke's College, Morningside University, joining forces, forging a new path together, which is just incredibly exciting from my vantage point. And I think what we want to do is just have a conversation today. I think a lot of the listeners and people watching this, I know people in the community that I chat with might have questions and want to know more. So I'm just excited to talk to the two of you about this. But I want to start with Jackie. I know people know you from Morningside. I mean, through and through, right? We were just talking earlier about that we're all ambassadors of Morningside. You're rocking Morningside gear, running into people, talking to people everywhere. But you actually have a history with St. Luke's College as well, right? I mean, tell me a little bit about that. I know that you have experience at both institutions, but I think that's so interesting that sometimes our listeners might not know. So tell me a little bit about that.
Well, absolutely. Actually, very, very proud alum from St. Luke's nursing program. That's what it was called back in the day. Don't really want to date myself, but I'll tell you, I'm a very proud 93 grad. Anybody from that class will tell you it was absolutely the best class. When you look at the group of nurses that came out of there, we definitely think we're the best. Now, I'm sure if you asked other classes, they might say they're the best, but it's interesting though, because St. Luke's has a long history of evolution and how they evolved. And back when I went there, it was St. Luke's nursing program. It was a diploma program, so it was a 3-year program. So it's kind of a unique thing we don't see around here much anymore, but it used to be something then. Yeah,
and it's evolved over time, at least at that institution and perhaps others as well. But that's so interesting of what that was like. So talk to me about that. Yeah.
Over time, it was probably way back in the day was more like nursing training, and then moved into a nursing program. And was a diploma program for a long time. Diploma programs are unique because they're you don't come out with an associate degree or a bachelor's degree. You come out with a diploma, but they're very strongly rooted in clinical practice, and so they're tied to hospitals, and they really feature that high quality, a lot of patient care, and that nursing care that you get. Kind of much more of the on the job training, if you will,
vocational,
but very much like that. Yeah. Yep, it was the idea. They came from that idea of vocational training.
Sure. Which I think a lot of other, industries use and think of that, think of that type of training on the job. Okay, you're going to be an electrician. You go towards that. You want to work in healthcare, you can go to something like that as well. And they've had a long history. I mean, we're going back, 100 years?
Yeah, 100 years too. Yeah, very, very true. And it's interesting because I think when I went, I was getting closer to the tail end of it being a diploma program, because diplomas across the nation was moving more to associate degrees. And I want to say it probably phased out the next 5 years-ish or so from the time that I was there. So it was, very unique. I think there's probably maybe only 2 in the nation now that are diploma programs. But
wow.
Yeah, just interesting. And then they transitioned to an associate degree program. You look at it and you think about all the benefits that come from change. And one of the things that I think allowed opportunity for them to expand and add programs like radiology technician and respiratory care, being able to meet the needs here in Sioux City. And, they're the only programs that had that. And it was a nice addition, I think, because then people would come out and they would earn an associate degree, then that led to a good pathway for advancing their education if they wanted to. So
when you just think of how many healthcare professionals in our area, our region, I mean, obviously, Morningside has been putting out a great nursing program for decades as well. But to have a vocational style of education program over there that was really just pushing through and able to produce such high quality health professionals in our area really made an impact. Jackie, then talk to me a little bit about what they currently offer and kind of how we've been coordinating and collaborating with St. Luke's College even before we got to this step.
And I don't know if people realize we have Morningside University has a long history
of working together, right?
Working together. I mean, we had many, many years where we provided the support courses. We provided their general education courses on their campus, so our faculty would go over there and teach the classes and just kind of really be that joint effort. And then after that, too, then they started offering their own gen eds, and then so we transitioned. But I think another exciting thing that happened was that we had the opportunity to do a bachelor's degree in radiology and respiratory care. I think that's super important because that allowed a different pathway for students, but that was through a joint effort through St. Luke's. So our students did 2 years here for their bachelor's degree and then completed 2 years over at St. Luke's campus.
Yeah.
And then they earned both an associate degree and the bachelor's degree and were able to come out and achieve their goal at a little bit higher level if they wanted to advance their education. So we have many years of doing that. And that's what I think is very exciting for that. The medical laboratory science program, the same thing. We have graduates that completed that opportunity. They received their bachelor's degree in biology, chemistry here, and was able to obtain that certificate to become a medical laboratory science person in the field.
So that integration, I mean, and that just collaborative nature has been operating like that. I mean, for quite a while since I've been at Morningside, it's been operating in that function, and I think it's really worked well. We've seen a lot of good come out of that too.
And I want to say that the collaboration is much, much deeper than just courses you're offering or degrees or programs that you're offering. We're talking about healthcare professionals that have been in this community for a long time. We hope and tend to prepare people for their career, and we hope that they stay here, and we know they're well prepared to stay here or go where they need to go too. But when you look at it, we've worked with their faculty at St. Luke's campus on many, many committees, organizations. We know each other. We have a rich history that, preparing our healthcare professionals,
just getting preparing for the future and just able to collaborate in that way and just put out and produce high quality healthcare professionals, which is really both of the goals of those two programs. President Benson, I want to bring you into the conversation to talk a little bit about that from a 30,000 foot view. I mean, as an interim president, I mean, you hope for almost like a lame duck session that it's like, hey, you can come in, keep the wheels going, keep it on
lame duck session. Not so much.
Hey, exactly. You've been thrown a lot of curveballs and just really met those things head on, which I really appreciate about you. And I think that you can maybe add a little color to the conversation of how did this start? Like where did this notion come about? How was it brought up? And what was the precipice for that, or kind of how we got to start to get the ball rolling to get here today?
Yeah, great. Well, first of all, I would say we are blessed in our community and at our university to have this individual, Jackie Barber, and
amen,
our university and in our community. She's got such a passion. And, I think I would say that Jackie, being an alumni of both institutions, was kind of at the center of what was most important for us. And that is, when we first started these conversations, we wanted to make sure that the legacy of St. Luke's and what both organizations brought together, that we ended up with the best of all of that. And so I think what really makes it easy is both organizations, as Jackie pointed out, in our faculty and our staff, we have Morningside and St. Luke's graduates commingled. And so there's a lot of deep interest in making sure that we're preserving, the histories and cultures yet
of both
moving forward, right?
Yeah.
So, and with that being said, I also, like, in the midst of trying to get all of this done, right? We're a small little team here at Morningside, and a lot of people worked very hard in our administration and at St. Luke's to make this happen, and it's tedious, right? Literally, hundreds and hundreds of documents and thousands of pages of
I was going to say,
we have to
filing, forms, accreditation, all kinds of different things, moving parts.
It's a little bit mind blowing, and so, like, a lot of people get a tremendous amount of credit for getting us to this point, which is when you think about what's happened to this point. The Higher Learning Commission approved this in November, and then December 31st, we took over, and acquired St. Luke's. There's a second phase right now, which is the U.S. Department of Education approval, and that process is underway as we speak. So we got another step in the process, but this all started about 15 months ago, and that journey was a couple phone calls and some discussions and conversations. And I think as we got to know the team over at Unity Point and St. Luke's, and they got to know us, it became very obvious that when you look at all the stakeholders, the community,
for sure,
students, the faculty of both institutions, and really what the combined opportunity from a pathway standpoint can really mean for our community and the combined university, we can invest, I think, differentially into broadening and making sure that the associate paths and the bachelor and the graduate level plus paths are really built out and robust, right?
Yeah.
And so it also helps us because we were kind of at capacity here at Morningside, right? So now you think about it, we have not only a campus based nursing program, but we've got we've got a facility over at Uni Point in the healthcare environment. So like the combination of these two give our perspective and current students the opportunity to experience things like very few opportunities in our state. So I think this is a really exciting thing for somebody who's in our program or going through our program.
Well, and able to meet so many students where they are.
Right.
Whether you're intentionally seeking an associate's degree or once you are over there and you're thinking associate's degree, and gosh, then you have the opportunity at Morningside to advance or to think what are those additional steps you want to take. Now we can meet them where they are and have this intentional integration to where we're producing this high quality healthcare professional, no matter what path they want to go, whether it's an associate's degree in one of those that you mentioned, Dr. Barber, or thinking about, I want to go on to get an advanced degree through Morningside.
We understand in the region how important healthcare professionals are, the availability of them, and also, the ability for them to grow in their careers as they desire to do that.
Yes.
And I think you struck on one thing that's really important to us, and that is the quality of our combined programs, right? And and so now that we're in the midst of this, we're moving very quickly as an institution. Along with our St. Luke's team, our faculty and our administration, to really kind of set the runway to expand and grow this program, deepen our relationship with Unity Point. They've been a great partner. Jane and her team over there are very responsive. Our goal is to make sure Sioux City has the right care for the things that we feel we can do exceptional. And so, if we're going to do something at Morningside in the Nyland School of Health and Science, we're going to do it exceptional, and we're going to put everything we can into it to give that student the opportunity to come out at the highest capacity they can to serve, serve in the healthcare
just
space.
And maintaining that high level of education at both of those institutions,
Yes.
but now truly bringing them together to forge that common mission and goal. And one thing that you touched on, I mean, is the shortage of healthcare professionals, not only in this state, but in a lot of across our region and across the country. And so really what I've always appreciated about Morningside, whether we're talking aviation or otherwise, is we're meeting the need for the region and for the country to try to educate and produce these high quality professionals that are ready to get into those positions and truly make a difference in their country and wherever life takes them. Now, President Benson, one thing that you mentioned, or a word that you used that I feel like sometimes, at least in the community, it can trigger a negative reaction. And I wonder, how you view that, how you see this, this integration or collaboration. But when people hear the word acquisition, sometimes there's just a negative connotation. But I think we're trying to dispel what that looks like. Can you tell me from your perspective what you see this as, and if people have that reaction, how we can maybe reassure them of what our vision is here?
I think the easiest way for us to translate it is by how faculty, staff, and students, right, at St. Luke's view and evaluate their experience relative to their expectation. In many other ways, right, it comes down to executing from an academic standpoint, and it comes down to executing from an administrative standpoint.
Yeah.
But the outcome is about cultural immersion.
Mm-hmm.
And that, I think, if faculty, you can look a faculty person at St. Luke's or an administrative person or a student at St. Luke's in the eye, and they say, I'm really, really happy with what's happening in my experience, that's the thing that matters most to us. We want to make sure that they are happy, that they're engaged, that they have the tools and the resources, that they have the integration here. We're doing a lot to make them feel very much a part of our community. And Jackie has done a really good job, along with others, to make sure, we're engaged with them, because this is a difficult thing, right? It seems easy because they're just across town.
Oh my gosh.
But we all know, like, how easy it can be to lose sight of that connectedness. And so we're being very intentional about that. They are a part of us, and we are a part of them as it relates to infrastructure. So, and resources. So that's how I gauge it, right? Everything else, right, is it's important, but culture will tell a lot of the story.
To your point exactly, is even though that campus may seem separate, right? Like it's a different space or a different building.
Yep.
We all have one mission, one culture, one mission, and now we're all on the same team, going in the same direction, trying to make that difference. Now, Jackie, I wondered, from your standpoint, and President Benson, yours as well, you both can chime in here, what do you anticipate is kind of the immediate change, or what would have been, or what has been the immediate change to St. Luke's College? Anything in particular?
Well, I mean, I think change is change, and so it takes time and stuff, but there are things that I think we were able to implement right away. One of the things that I'm very proud of because of this initiative is that we were able to immediately start working on revitalizing a energized lab for radiology. So a learning space that is very much like a real learning space for radiology students to learn how to care for patients.
And have that hands-on experience, right?
Hands-on experience that really is truly, that mimics the real world. That's a big deal. When you start looking at being able to immediately renovate a learning space with high technology equipment and have it done, I don't know, was it like 3 weeks or something? It was amazing time, but that was a joint effort. And then not only just that room, but then we've already started room 2. So our students immediately got in week 3 to start having learning experiences in that lab space. I think that's something tangible that you can see. But immediately too, I think, making sure that we're supporting the students, making sure that they had a seamless transition as much as we could, and then also to make sure that we're there to support them, and then along the faculty and staff.
We did everything we could too, as far as I know, retaining staff and structure.
Yep.
I mean, I think that some people, like I was saying with President Benson, hear the word acquisition and you think, oh, we're cutting and gutting everything. And that seems like it has not been the case at all here, that it's just been more of that intentional collaboration.
Yeah, absolutely. The programs that we brought on, we were able to retain the faculty and pretty much most of the staff too.
Yeah.
So I think that's a good feeling. I think too, looking at it, we value all of the skill set that the faculty and staff bring to this initiative, and I think that and they're well known in the community too, so they'll continue to help support the initiative and move both campuses together. And
yeah. President Benson, you want to
a few things I would add. So I think I would say we're moving at a pretty kind of Mach 2 type.
Oh my! Most definitely.
Everything is moving quickly.
So we're listen, we have a kind of a mandate to do things right and do them as efficiently as quickly as we can, because ultimately we want to get to a point where people can get up every day and not have to feel a little bit like they have other stuff going on. They can teach, they can do the daily tasks. The other thing we'll be doing is we're looking at programs, right? Like, so what are we gonna grow into? How are we gonna grow into? What's that look like? And I think that's really awesome. Jackie and her team have, we're looking to add additional spaces for lab.
Yep.
Rad.
Yep. Even for nursing. Too,
yeah. So I think, this program that we acquired in St. Luke's, was a pretty expensive program, maybe 10 years ago, right? And so, we've started to market more in different ways than they've probably done in the past. And then, I would say in certain programs, we'll probably look at if we can be a little bit more cost effective, right?
Yeah.
So I know there was always a concern like, hey, is Morningside going to raise prices? Like, that's not our intention. We're actually going to look at as we're bringing, opportunities on, and especially like in the associate pipeline, where do we price those? Can they be effective? Are they going to be competitive? All of those things go into account. So like, we're looking at a lot of good things that I think, will be good for students, prospective future students as well.
At Morningside, we've even seen this too, right? There's a range of students for what they want to pursue, what they want to go into, and meeting them where they're at is just so important.
Yeah. I think that strategic planning on how we're going to grow each program, we are already seeing it and experiencing that with the great things that they're doing in the respiratory care program. And so I think, that's something too that sometimes we don't always think about those types of programs right away, but there is great things happening there. And you can see that. I was just there with the students and stuff too, and it's when you see that hands-on experience that they get, and the hands-on experience in clinical. So we were talking about like what has changed immediately. Our availability for clinical space. I mean, we were able to get fabulous clinical experience, and that will continue in this as we move forward and trying to build these programs and strengthen them. So I'm excited for that, because that's the best part, is to see the students and the faculty in clinical doing what they do. We value lifelong learning, and this is a good way to do that, because we have it. We're able to provide that for the students. If they don't want to go on right away, we're here for when they're ready, and if they go on right away, we're here now.
Yeah.
So I think I like that part too. I'm all about pathways, and I'm all about every person's experience is different, and we need to value that. And so I think that when we recognize how their experience is different, what their needs are and what they're looking for, and be part of that journey, I think this thing will be very, very successful.
These are two places that have storied legacies. I mean, Morningside University, St. Luke's College, both of them being around just shaping healthcare, not only in the immediate Siouxland area, but in the region, and forging together to really have that future. And I think that's such a poignant kind of direction to think about this. But another thing that you frequently refer to your vision for Morningside is that Morningside in motion.
Yeah.
And so when we're thinking about Morningside in motion, and then we have these two legacies in one future, I just wondered, how do you see St. Luke's College fitting into that Morningside in motion? How is this part of your overall vision? And could you just elaborate on that?
So I would say that, when you think about, what we ask of each of us every day is to get up and be exceptional every day, give our very, very best. And so, we're at a point in this, combination of two cultures, right, that are coming together and a history. And if you think of St. Luke's, they have over 4,000 alumni. They have a very tight network, and you have Morningside kind of doing the same thing. And I think you always learn from the past. And so what's important for us is that for that alumni base, they see and feel the essence of what they went through in their experience as a St. Luke's alumni, and that we honor that. So I think that's really important. I think the other thing that is really important is our goal is simply to understand the market. And, I'm a firm believer is if you can understand the problem you're solving, right, clearly understand the problem you're solving, and then you can actually put things in action. What's the data tell you? What do the facts say?
What's the need?
What are we solving for? And so I think what we've done up to this point is we really understand in this community what Morningside now is a meaningful part of the healthcare resource developer as an institution in this area, what we need to do to satisfy that, right? Yeah. And so I've had an opportunity to talk to a lot of constituents, a lot of folks around town, and that's what I tell them. Like, we are going to be a catalyst for solving these problems and these issues to make sure our community, those in need of health, have the resources available to provide them in their system. So, you have to really take the time to understand what you're solving for. I think we have a pretty good idea of what that is, and now we'll just start to go after it. And Jackie's got a great team. She's got a lot of support. There's a lot of resources around our campus that are going in to help do that. But at the end of the day, this is about providing an opportunity for the next generation of healthcare provider and a place where somebody can come and get the skills and that grow as an individual and the competencies to step into a role in healthcare.
Jackie, one thing that I wanted to think about, and I bring back, I appreciate everyone tuning into this episode of Inside Mside. I think it's really important to have these conversations, and I think about the people listening, maybe some are similar to yourself. They're alums, or like President Benson talked on, they're alums of the St. Luke's College program. And if we know anything at Morningside, it's whether you transition mascots, you transition the name of a a college to a university, or you merge and blend two programs together. Sometimes that can have some feelings associated with it. I'm wondering, for you yourself as an alum, or for any St. Luke's College alum listening today, really, what should make them feel confident or even excited for where the future is going to be with this nursing and healthcare education in collaboration with Morningside?
I think that the excitement comes from the opportunities and the opportunities to grow, and not just number, but again, grow in that experience, grow in that quality, grow in, again, preparing our providers to be competent and to have the confidence too when they go out into practice, so that they're sustainable, that we can sustain them in practice. Yeah. But I think like for me, it's still the experiences. You said it well. It's about the experiences. You hold so tight to your experience that you had somewhere when it was something that you can remember. You can remember that person that helped you through something. You remember the study groups that you had. I remember my study group in the auditorium at St. Luke's, and I said the auditorium because anybody watching this that's from St. Luke's knows exactly what I'm talking about. I remember my walks through the tunnel to get, our drinks to go back to class. It's those things, going up and seeing what our scores are. It's those types of things that matter. I think combining that and how well that I know we will prepare that next generation of our healthcare providers. I think that's what we're excited for. I think those are the opportunities, is knowing where that future is going to go. It's hard to give up, like you said, the little traditions and stuff like that. There'll be new traditions, and I'm positive we'll remember the old traditions.
Yeah.
I'm positive we've already got plans in place of how we're going to honor things that have already been established at St. Luke's. There is a Serenity Room at St. Luke's in honor of a highly beloved faculty member that passed early, and that room is still going to be there. It's still going to be there with us, and we're going to cherish that. The same thing with looking at how do we go back and pull in alumni from both groups to get to know each other and learn from each other. That'll be there too. So I think it's the opportunities that's coming that we know will be there, but know who we are. And we're not a one group, we're a collective group. And I think that's really important.
I talk to alumni a lot, of how Morningside has changed, Morningside has evolved. And in the same way, I would encourage St. Luke's College alumni to think of it through that same lens, is that we can be extraordinarily proud of the experiences that we had, the education we received, the people that impacted us. But we can be equally as excited for the future generations. But I do want to give, you should always probably give the opportunity for the president of the institution a final thought or word. And I want to offer both of you that opportunity.
Yeah.
If there's anything you'd want to share.
There is. I think the one thing that I would just say we're going to be doing a lot of activity up at St. Luke's, and we'll do some community stuff, right? So we want to help the community fully understand kind of where we're at and where we're going, and community leaders to see and buy in with us in Unity Point as we're, going on this journey. Because we do have a very strong partnership with Unity Point and Jane and the team. And it takes that, right? It takes that to make this all work. And, I just am excited. These can be very challenging, and this has in certain sense, but I'm very optimistic, I guess, to say about where we're headed. We got great leaders. We got people, on the ground that want to make this happen, and it takes that to make it all work. So,
and if you have the right people in place, like you said, because I think whether we're talking that institution, the people we were able to retain, but also the people here at this institution, how dedicated they are to that collaborative environment and to forging ahead and making sure that we have that one strong voice moving forward into the future. I think that's going to make all the difference. And I thank the two of you not only for joining me here today on Inside Mside, but also for just having the vision and the willingness to take these next steps and forge ahead. I think it's an exciting thing as a person in this community that obviously has utilized a lot of the healthcare in this community. I think it's something that's much needed throughout our state and throughout the entire region. So I thank you so much.
Thank you. Thanks for having us.
Thanks, Jack.
No doubt.
Yeah.
All right. Thank you so much for listening to this episode of Inside Mside. Tune in for next one.